Welcome to Aula Dentaid Stay at Home, and thanks to all of you who are connected worldwide. Today, we are going to address a very interesting topic and still very present across different countries worldwide. What measures we should implement working in the dental clinic during this period from a very practical point of view. We are very excited. We have Dr. Gema Maeso teaching today's course. Dr. Maeso is doctor in dentistry by the Complutense University. She's a specialist in periodontology recognized by the European Federation of Periodontology, master in preventive and community dentistry, associate professor at Master of Periodontics and Implantology in Complutense University. She has made numerous international publications. She is a lecturer of several courses about periodontics and asepsis, and during this period, she has addressed numerous webinars about asepsis and the prevention of cross-infection during COVID-19 period. So we are very lucky we have Dr. Gema Maeso giving today's course. Dr. Maeso, welcome and thank you very much for being here.
Thank you, Ernesto, and thank you, Dentaid, for inviting me for giving this presentation, and thank you to all of you for being attending to this. As you know, I am going to present you the new protagonist of this year is coronavirus. As you know, SARS-CoV-2. It appeared officially in the last part of the last year in Wuhan, China. It's an a virus with a lipidic envelope, which causes severe acute pneumonia, and other problems like skin problems, kidney, and several times it causes, the most part of them, the 85% of the cases are soft cases, but in the 5% it can cause the death of the patient. As you know, it appeared in China, but rapidly it spread all around the world. It's first in Italy, and after Madrid and Spain. And nowadays, most part of the world is confined, and there are a lot of deaths. And by the moment we are waiting for the vaccine, there are several laboratories running for the research, but by the moment it doesn't exist, we don't have any effective treatment. So by the moment, what we only have to do is only prevention. Prevention, because of we have a profession which we are very near the patient. We are near the mouth of the patient, and we are dealing with aerosols mixed with the saliva of the patient. The objective of this session is to have a practical approach of one day in a surgery. I'm a periodontologist, so this is my profession, but the single difference between making a surgery and what you can do normally, for example, an endodontic or another specialty of dentistry, is the sterile field. So everything I speak is more or less for everyone working normally with coronavirus patient or not, because of we have to practice the principle of universality. There are a lot of patients which pass through this disease asymptomatically. So when we have a patient, we don't know if this patient has coronavirus or not. We're going to have a practical approach of Anna. Anna is going to be the other protagonist of this session. I made her some implants, and now I'm going to start talking about the staff, my dental clinic staff. First of all, before starting to work, we review the health status of everyone. We make tests before starting, but every day we go to the clinic, we check our temperature, And we have, if you haven't started your profession again from the confination, you have to make sure that all the equipment has understood, has courses. I have made some courses for not only for them, but also for the rest of the people from all around the world. But they have attended not only my courses, but also another companions courses too. The first day we started again with the clinic, we made a simulacrum. We made a simulacrum with a false patient, so as to make into practice everything they have learned. One tip that I'm going to tell to you, if you haven't started yet, is that at the beginning everyone is going to be a little bit nervous because of it's a challenge to work with this kind of virus, which has caused a lot of deaths. So you know, all the staff is going to be a little bit nervous above all at the beginning, but with the work, they are going to be more safe because of our measures are very effective. All of my staff has been negative. That's why I think our normal protective measures are okay for being protected against coronavirus. There are some tips that the day-to-day practice, for example, to use everyone his own pen, for example, be careful with the telephone, not to speak with a patient and after to pass to another. There are several tips that we have to make sure that we try to avoid, not only to avoid the contact with the patient, but also between us. It's very important before starting your dental practice to have physical presence of all the media in the clinic, for example, the protective equipment or the hydrofoil solution. It's very important to check that everyone has understood everything and try make simulations as much as possible, because of it's very important to avoid cross-infection in the clinic. Now we are going to start with the day with the patient, with Anna. The day before, we made her a telephone triage so as to know if she has had any contact with any patient with coronavirus, if she has had some fever the last 14 days, if she has vomit, all the symptoms, the normal symptoms of coronavirus, COVID-19. It's very important to make sure that the patient isn't active by the moment. But as I have told you before, it's very important to try to work with everyone the same way, because of the principle of universality. Is very important above all with this virus. The last question is about what we do have to do, because of we are going to make a study stratification of the patients, so we have to know what time of the and how many time do we have to need. When we speak with her, we are going to give him some instructions so as to avoid the surprise of the patient. For example, it's very important to come alone if possible. If there is a dependent person or a children, they will have to come with some person. But if possible, our goal is to keep the waiting room alone, so as to avoid people being in the same waiting room, waiting unnecessarily. It's important to be punctually, so as to, as soon as they arrive, go to the cabinet. If possible, they have to wander, if we are delaying, wander on the street and make a telephone call when they are near, so as to make sure that we don't have queue and not to wait in the waiting room. I will tell her that it's important not to wander around the clinic. If possible, not to use the toilets. We are going to offer her the hydroalcoholic solution. We tell her to come with her mask so as to avoid the aerosols when they arrive. And we will offer, as soon as she comes, the hydroalcoholic solution, and we will check her temperature. We will offer her some glazes, shoe covers, as you know. We're going to give her a hat, sorry, for the head. And at the reception, we are going to have 6 feet separation from the desk. Ideally, I have put, as you see in the picture, a metacrillate screen, and the person who is working there, we will have to use a protective equipment too, with screen glasses, mask, and we're going to cover the data phone with film and make a regular disinfection of all the desk and all the things that we are going to touch. The waiting room and the common areas have been changed. First of all, I removed all the magazines, the TV remote. If you have a coffee maker, we will take it out because of they are places where the people touches. So we will try to minimize the time in the waiting room. We're going to try to avoid to minimize repeated appointments. We will talk with the patient so as to profit the time and try to do as much as possible in one date. We will remove all the decorations and toys. For example, I have a square with a place with the children. I have took all the toys off. And we are doing a continuous cleaning continuously. We will try to work with the window opened. I have all windows in all the cabinets and the waiting room. So if possible, we will try to work with the window opened. The toilet will have disposable towels and soap dispenser in the bathroom and continuous cleaning. The patient should avoid to wash to clean their teeth in the clinic because of they can make an aerosol and contaminate the toilet. Our changing rooms, we will try to avoid the contact of the street clothes with the clinical clothes. As soon as we arrive, we will put the clothes inside the plastic bags with our belongings. And when we finish the day, we will carry clothes and inside the closet bags, and we will wash it separately. The reception staff, we will make a separation, a certification of the diary. We will put the elderly people. As you know, this is a picture of my mother, for example. The elderly people will come at the beginning of the day, at the beginning of the morning, or at the beginning of the evening. And the people who will have to use, we will have to use aerosols, for example, they will be at the last time of the day. So it's very important to make a stratification of the diary in this way, and it's very important to take into account that we're going to need some more time with each patient, not only for the treatment but also for the moment before, after, because of we are going to clean everything very meticulously. We are going to have minutes for windy the room, so we will have 15 extra minutes for disinfection. We will try to avoid in this stratification to plan treatment to avoid these appointments. Use, for example, sutures reservable. If possible, have an isolation box. If you have a lot of boxes, you can use one for using with patients with suspicious of coronavirus. If possible, avoid them, but if it's an emergency, you can use an isolation box. Or for using for aerosols, we will try to have a box with a minimum furniture and equipment. The top has to be as clean as possible without any unimportant things. We will work with closed drawers and a clean worktop. The rotary with which we are going to use, they have to be stored. Only take out everything you are going to use, and avoid to have outside the, for example, the turbine. The turbine, if we are going to use it, you can have it stored. It's very important to be careful with whatever we are going to touch. For example, the composites, the orthophosphoric acid, because of they are things that we are going to touch, and it's very important to disinfect it perfectly, or use it in small pieces, all the things that we are going to manage. Try, if possible, to, if we are going to use aerosols, use the box as far as possible from the waiting room or the other cabinets, if possible. And if we have a negative pressure systems, or work with an open window, as is my case. And the visit has to be with the door closed. But we're going to talk about the barrier, which is going to be the most effective measures. The barrier is, we are going to try to avoid use the nail polish, short nails before going to the clinic. We're going to remove watches and jewelry. I don't remember the last time I used earrings, for example. They are reservoirs, and the rings, they are reservoirs which can go to your home. The hand hygiene is very important. As you know, the World Health Organization has been talking about the importance of the hand hygiene. We're going to make it before examining or treating any patient, after touching any patient, if we touch any contaminated surface, or if we touch the patient mucous membranes. It has to last at least 14-16 seconds. And after it, disinfect with an hydroalcoholic solution for further 20 seconds. The protective equipment, for example, in Spain, every country has their own laws, but it's certified in Spain by the Royal Decree 700 of the 1997. In Europe, we have this law, the 2016 425. They are every protective equipment has to follow some laws that it's important to check when we buy some protective equipment, that is available for and is safe for us. When we are working, the basic protective equipment is use a disposable cap. I use my normal cap, but over it I have a disposable cap. It's very important to protect your hair because of it's a reservoir for the coronavirus. We will try to use a visor or tightened glasses. I've been always talking about the screens because of it covers the most part of the face. We will use a FFP2 or a N95 mask, and over it we will use a surgical mask that will be disposable between the patients. We will use a scrub set, a disposable waterproof surgical gown, and shoe covers that it's important to use too. The surgical mask, the patient should arrive with it, so as to avoid the aerosols in the moment they enter the clinic. The mask with valves provides us the be safe, but we can exhale virus too. So the mask that we are going to use is preferably without bulb. And the surgical mask has to follow this law, and it's important to discard after each patient. We're going to use clothes with simple lines, clothes which can be used in, they can be washed in high temperature. We will change it daily. Of course, we're not going to go out the clinic with these clothes, and when we wash it, try to avoid to mix it with the household linen. The gowns must be disposable and waterproof so as to avoid the contamination. Another law, it's important to make sure about the laws, because of they are selling some protective equipment which aren't safe for us. So make sure what you buy is effective. The cap must be disposable and clogs under the shoe covers. And I'm going to talk about the gloves. It's important to know that the gloves has micropores. This is an study, as you see the picture. I don't know if you can see the holes. There is a comparison of latex gloves of the clinical different marks, and they have little pores, and that's why it's very important to make a meticulous hand cleaning, and they have to be changed every 15-30 minutes, because of the barrier will be will not be perfectly after this time. The vinyl, it says about 15 minutes, but I don't recommend use the vinyl gloves because of they are very permeable. I'm allergic, and I used them before the appearance of the nitrile gloves. I several times I started to make a surgery or something, and I could see my hands dirty with blood. So it's very important to avoid them. And the latex or neoprene surgical gloves, as you have touched, they are thicker, and they can be used for 1 to 3 hours because of they are 3 laminar several times, and they are thicker and they are safer for us, for above all for the long treatments or the surgical approaches. It's important to use 2 pairs of gloves. One of them is going to be the second skin, and over it we will use one which is going to be discarded every patient. And for the person who is in charge of the making the disinfection and the sterilization of the instrumental, it's very important to use this kind of gloves, as you've seen in the picture, which they are thicker, and use a latex glove, and over it this kind of gloves. It's important to know that most part of the accidents aren't in front of the patient. I don't remember the last time I punched myself, but when the staff is managing the instrumental, it's a moment which a very risky moment of a puncture. About the eye protection, I'm a fan of the full face screens, not only with the apparition of the coronavirus, but also several years ago, because of it covers all the face. It prevents the splatter to the surgical mask, and the glazes protect the drops. The laws aren't specific for the against microorganisms. This law, which is refer to the eye protection. It's referred more about the impact protection, about liquids, the dust, but not for the microbiological aspect. As you know, the eyes are an open wound. These are images from a study which use the contact lenses contaminated after doing a roof planing, and this is the result of the cultivation after a single use. If you are going to manage a patient, use a level A protective equipment. I work with every aerosols of the same way. And it's important to know that there are not evidence of more coverage is the same to more protection. Is above all, with the impermeability of this kind of preventive equipment, the transpirable one are more comfortable, and another way is the withdrawal difficulty may make some cross infection in the clinic. This is a study of Barbeck, which is actualized every year. It started with the Ebola virus, and they concluded that using simply a disposable gown can be prevent the same than a whole equipment. And we're going to do inside the box. This is the normal, the World Health Organization order how to manage for a normal patient, to take out all the jewelry, to dress, the hand wash, use the first pair of gloves, the gown, the mask, the face screen, and a second pair of gloves. But we are going, in this case, we are going to make a surgery, so there is a little difference. First of all, we are going to make, we are dressed with the pajama, and after we will make an hygienic hand wash. I put the clothes, I put my disposable cap, my mask, my surgical mask, my goggles and my face shields. And after, I'm going to make a surgical hand wash, which has to spend more or less 10 minutes, with a disposable scrub with iodine or chlorhexidine soap. After, we will dry with a sterile cellulose, and we put our surgical gown, after our surgical gloves, and we will prepare the surgical field. This is the single difference with another specialties, because of I'm a surgeon, and this is the difference. When we prepare the surgical field, it's very important to cover as much as possible, to use, if possible, cover for everything we are going to touch, and if we can't touch, we will cover with films, for example. And now I'm going to talk about the airborne transmission. I'm going to make, in this case, a dental implant, but for example, when we do a surgery, a periodontal surgery, as you know, we're going to make a lot of aerosols. There are a lot of studies against and pro. There are no evidence of airborne transmission. There are studies of restaurants, and there are studies against, for example, negative test on exhaled air in coronavirus patients. There are no viable viruses in air samples. The air transmission is not proven. The receptors AC2 are very abundant in the oral mucosa, or the airborne transmission in humans or animals has not been proven yet. But the problem of everything is that we are new with this virus, so we don't have any evidence of almost anything. In favor, as you know, it causes early lung disease, so maybe the airborne transmission may have is the cause. The symptomatology increases the virulence. The RNA is found in salines with the patients, and in several studies they have found it in their samples. Abundant ACA2 in lungs. There are people who is super contagious, so maybe the airborne transmission is in these patients very important. There are studies very special in under certain conditions, which the aerosols, the virus, can be stable during 3 hours. That's the importance of windy the room. The SARS-CoV-2 can be transmissible. The SARS-CoV-1 can be transmissible in aerosols, so maybe we can translate it into the SARS-CoV-2 the same. Which are the steps in the airborne control? First of all, control the source. That's what we're going to be able to do with the patient with the suction. The ventilation of the room is very important. Of use the forced aspiration, the windows, or the and finally the air purification with HEPA filters or ultraviolets. It's very important to know that a lot of people is buying a lot of devices without any proven activity. So any device you buy, there is a formula which is written here. This 60 for the device flow. Divided into the room volume, we will take us the interchange rate per hour, and it's important to make sure minimum at 6 times per hour. So we are going to, is in our hands, the source control. We will try to avoid the aerosols, for example, using extraoral X-rays, because of the intraoral can provoke the patient the vomiting moment, so they can exhale more aerosols. We will try, if possible, to work with manual instrument. Work in pairs, very important, so as when you are working, your assistant can be aspirating with their surgical aspirator the aerosols we use with the ultrasounds, for example. Try to use rotary instruments with anti-return systems, very important. But it's very important to sterilize. It's not disinfect the rotaries. It's very important to sterilize into B autoclave, because of the S autoclaves that a lot of people has in their clinics aren't very effective inside the turbines, for example. We will try to avoid water strangles too, so as to avoid the spray, the splatter of the saliva mixed with the water. So we will try to decrease the viral load. How we are going to do it? We will offer the most part of the studies talk about the iodine or with the oxygen peroxide. The problem of both is the substantivity. The oxygen peroxide, for example, doesn't have any substantivity, so the patient will make their mouth rise, but it will be only in the moment. The saliva is a source for coronavirus, is a reservoir, so we will try to use something which provide us some more time. There are studies about the acetylpyridinium or the compounds of the ammonium quaternary compounds, which are effective with the elimination of the viruses with the lipidic envolture. So we can use it for avoiding and for keeping it during more time than the iodine or for example, the peroxide. There are a study with only 2 patients, so we don't have any relevance by the moment. They will make further studies. At the beginning, they talked about the chlorhexidine weren't so effective with the SARS-CoV-2, but there is a study with patients with COVID-19, which they make a PSR at the beginning, and they offer the chlorhexidine at the moment, and they repeat the PRC several times, and they found the effectivity during 2 hours only with chlorhexidine. So maybe we are making mouth races with the wrong material. So we are going to try to avoid, the aerosols with the source using, for example, the plastic dam. In my profession, it's very difficult to use it, but if you can make an obturation with it, is a very effective way for avoiding the mixture of the saliva with the splatter with the water of our turbine. It's very important to use the double aspiration. We will use surgical suction or devices like this one. I use the surgical suction. Normally, this one, for example, in the picture, the colored ones, because of I know it in the splatter of the face shield, and if the assistant is following me with the suction device, I think it's nearly enough so as to avoid the aerosol splatter. This is another device for using with the turbine, with the rotaries, to avoid the splatter of the aerosols. We are going to make a surgery. So in a surgery, as you know, we have an sterile area, the dental seating, and the sterile field. And we start with our surgery, and after it, we will make sure that the patient is going to use their medication, their chlorhexidine, for example, which is very important for the moment after the surgery. And we finish the moment, and we have to collect everything we have used. The disposable material will be disposed in an appropriate containers. In Spain is the decree 1993, but every country has their own laws so as to avoid the puncture material. The disposable material which are used as a normal dust, we will use it in a pedal bin with a hard cover, and we will use double sealed bags so as to avoid the contamination of the personnel who is going to deal with the trash. After it, we are going to clean the surgery. We will remove all the films and to take into that bin. We will make a surface disinfection with hypochlorite, hydrogen peroxide, or ethanol. The most part, all of the materials that we use the disinfection for using for disinfection of the surfaces are effective for coronavirus, most part of them. So there are a list in the EPA which can be very clearly describe all the materials, for example, the quaternary compounds, the ethanol, is effective for coronavirus. It's important to clean the spitons, very important to suctionate with the suction device some water during 1 minute. And frequently it's important to clean the handles, doorknobs, and after surgery it's very important to clean the room during 10 minutes with the door closed so as to avoid the aerosol circulates all around the dental office. Talking about the disinfectants, has to be biocid. The alcohol or ethanol based are okay, the hypochlorite, and this is in the directions, the EPA gov, where you can check if what you use habitually for cleaning your box is suitable for coronavirus. It's important to clean from the cleaner places to the dirtiest one with a disposable towel with the product. And after, we will take all the material and follow step by step all the steps. We will collect the material. We will make a pre-wash or discontamination of the material. If we are going to sterilize it immediately, it's very important to use, for example, disinfectant to be wet or an enzymatic disinfection. We will use a manual or mechanical cleaning. If we use a manual, as you know, you have to rinse, to dry. If you use an ultrasound, as much as you can mechanize in the sterilization process is better. For example, the ultrasounds make less time of being manipulating the instrumental, and the perfect one is to use a thermodisinfector, which you go from the box with the material inside the cassette, and you put it inside, and it will process and it will clean and disinfect, thermodisinfection. So as it finished, we will seal it and inside and go inside the autoclave. If not, we will follow the rinse, the drying, the control of the instruments. It's very important to know if there is any dust, because of it will invalidate the sterilization process if they are dirty. We will bag it, the sterilization, and if possible, make a good traceability with verificators. Monitor if the autoclave is correctly working every day. And after the sterilization process, storage it into a room with if possible, a closed wardrobes during 6 months at como mucho at last, and make a regular check and test and a good maintenance of the sterilization devices. This is a sterilization room. The red point means the dirty material arrives there, and after the orange point makes when it is disinfected, and we will make the sealing, and after the sterilization, which is the place where they will arrive the material. Every time you will be in the sterilization room, it's very important to be protected with the protective equipment. And as the conclusions, the aerosol transmission is not very sure that it's the airborne transmission or not. So we will try to avoid it as much as possible. We will put a barrier between us and the patient with all of the measures that they are on our hands. We will try to stratificate the patients, very important, to avoid the elderly people at the last time of the evening, for example, or the people with medical conditions too. We will try to avoid sprays if possible, and minimize the viral load with the, for example, with the chlorhexidine or cetylpyridinium, and a meticulous disinfection and sterilization of all the instruments. And every time I have told is just to go far away from the COVID-19. These are measures that I've been, except from using the N95 mask and the complete protective equipment. There are things that we are using every day. We are dentists. We are used to manage with saliva, with virus like hepatitis, which are more resistant than coronavirus. Coronavirus doesn't resist a lot, but hepatitis, yes. So we have to avoid the cross-infection, not only with the patient, but also between the staff. So thank you to you for being attending to me. This is my email. I used to answer the questions whenever you want. You can ask me. You can follow me in Instagram for Dr. Maeso. And thank you to Dentaid for inviting me. And I will answer the questions if you have anyone. Thank you.
Dr. Maeso, thank you very much for this fantastic conference and for sharing your knowledge regarding all the aseptic measures we can apply in the dental clinic during this period for preventing the coronavirus cross-infection. And of course, it serves, I guess, for other cross-infections. Prior to answer the questions from our audience, I would like to remind to all the audience all the solutions that Dentaid offers containing CPC. You know, Dentaid is focused on improving oral health through oral hygiene solutions. We have high-quality manual and sonic toothbrushes, interproximal devices, but regarding specific CPC solutions, Dentaid recommend the daily use of toothpastes and mouthwashes containing CPC. In case of mouthwashes, we recommend to use them gargling. Why? To help to reach the throat, the outer part of the throat. In the slide, you can see we have different solutions containing CPC. Starting from the left, we have Vitis gingival, which is indicated for the prevention of gum diseases, mainly gingivitis, and contains 0.05% of cetylpyridinium chloride and other ingredients for carrying and preventing gum disease. We have also Vitis orthodontic, intended for the daily use of orthodontic patients, containing the same concentration of CPC and indicated for this daily care of these orthodontic patients, avoiding the rubbing, avoiding caries, preventing gum diseases, etc. We have another product containing CPC, but it also contains chlorhexidine, which is Alita, and other ingredients for the prevention and treatment of bad breath. And finally, we reach Perioate brand, which is the most powerful brand of antiseptics because it combines two antiseptics, chlorhexidine at different concentration, and CPC. Perioate intensive care contains 0.12% chlorhexidine plus 0.05% CPC, and it's indicated mainly for patients with that they need a periodontal treatment, of course, because it provides a maximum antiseptic effect. We also have Perioate active control, which contains a lower concentration of chlorhexidine, 0.05%, plus 0.05% of CPC, and it can be used for a long-term use because this low dose of chlorhexidine, it is indicated mainly for the periodontal maintenance in all these periodontal patients, but it can be used also for all patients that we say risky patients because they have to take more care about their gums health. For example, cardiovascular patients, diabetics patient, etc. So our message is that we should implement all the measures the doctor said to prevent this COVID-19 disease. And regarding the oral hygiene of our patients, we can recommend the use of these kind of products that may help to prevent or to avoid the risk of transmission of the coronavirus. So now, thank you very much. And let's go into the questions the audience asked. Well, prior to the question from our audience, I would like to ask one personal question. Well, not personal, one question from me, I mean, is that what's your opinion in if we should keep all these measures, all these preventive measures, even if the pandemic gets over? I mean, if the pandemic ends tomorrow, should we follow all these measures or not?
Yes, of course, of course. I have realized that the aerosols can transmit a lot of microorganisms, not only coronavirus, but also flu or hepatitis or AIDS. And it's very, very, very important to keep on making these measures because of they are things which are very, very effective, very, very easy to do. Only to use a gown because of all of our clothes goes really contaminated after a day. I have a lot of information for speaking during hours, but I have seen several photographs of studies with fluorine your neck, for example. The men who use bear, for example, it's not only the SARS-CoV-2, but also there are a lot of microorganisms which can produce problems, diseases that can be transmitted not only to us, but also when I arrive to my home, I've got children and they kiss me, and it's important to keep on with the measures.
I am fully agree. I will transmit another question from the audience. How many patients can you safely see on average with social distancing in place?
I've got my timetable full. I have 15 more minutes. It depends on what do I do. For example, if I make a surgery, it depends. Several times I need 2 hours, several times I need 1 hour. You only have to take into account 15, 20 minutes if it depends on your staff for cleaning everything safely. But taking 5, 6, it depends on the treatment I will do.
So it mainly from 5 to 15 minutes between each patient, no?
It's important that this date you have to use the same time that you used to have with any patient. Make sure that if you are a dentist, which is every time with delay in time, try to avoid this because of it's very important not to stress your staff. I have feel in my body how is stress with this change of the situation. The measures are the same, but they are scared of the problem. So don't stress more the people. So if you use, for example, half an hour, 3/4 of an hour, it's okay, but it depends on the treatment.
Okay. Another one we have is, what's your opinion on pre-procedural mouth rinses? I mean, that the patient rinses with antiseptic mouthwash, for example, you talked about CBC, for several days before going into the dental clinic, before visiting the
Uh,
dental clinic.
see, there is not evidence about this. Every measure you take is perfect. As less SARS-CoV-2 arrives to the clinic, better. But we don't have any information about 1 week or only 2 hours or only one. The best way is the patient before, half an hour before or 10 minutes before entering, will have a mouth raise, and after again, for us too, because of there are studies with influenza, for example, which are similar, which it says that it can prevent the contamination, the cross contaminations in schools, for example.
Of course. And we have another one. Let me see. Okay, what's your opinion on other methods of disinfection in this period of coronavirus, such as the use of ultraviolet radiation?
There are appearing a lot of devices of ultraviolet. The ultraviolet devices, it depends of the length wave. The short length width of 185 makes ozone. The ozone is bad for health, as you know. So we will try to avoid this kind of devices. The ultraviolet can be good, for example, for the sterilization of the air conditioning, for example, or special lamps for the surfaces of the clinic. But I have heard about devices to disinfect, for example, the instrumental, and this is not recommended because of it only cleansing surface, and we are dealing with not only with coronavirus. There are the shadow of the ultraviolets can keep contaminated surfaces too.
Okay, perfect. We don't have time for more questions. I would like to thank you again, Dr. Gema Maeso, for this amazing conference, which is going to be very helpful for all the dental staff. And we have to bear in mind that this is not over. This is still very active in different regions of the world. So I think all these measures, these protocols you mentioned step by step, it's going to be very useful for everyone. So thank you very much for sharing your knowledge very clearly. Thank you very much.
Thank you to you. Bye.
So, bye bye. We hope to see all of you in next Dentaid courses. Bye bye.
Bye bye.